Well, broadly speaking, the Alliance for Healthier Generation is a national children's health nonprofit. And we work in communities, we work in schools, and we work with families across the country to really create and enhance environments that supports children's physical and social and emotional health. And so we operate under what we refer to as an impact statement, and that's to ensure that every mind, every body, and every young person is healthy and ready to succeed.
Kathy, as I went over the website, there are so many different layers to what you do and your team does of 100 employees there when it comes to healthier generation. So maybe for some specificity for our listeners, What exactly are some of the things that you do that you're most proud of?
Right. No, exactly. So one is, just to share a little bit of insight, like how we do our work is by working collaboratively. I've mentioned schools, communities, families, and what we're doing is really supporting policy and practice changes, often referred to as system change, and really deploying effective communications. And so in doing that work, we're helping create these model wellness policies and opportunities for environmental changes so that the adult caregivers as well as the children can really have the opportunity to grow, to achieve, to learn in a way that would not be possible without our work taking place.
Kathy, I know that you've been in the role for 3.5 years, but this is an amazing stat that I read on the website today. Since 2005, 30 million children have been helped in some shape or form in over 2,000 schools. And then I took a look at the map in each state, and I know you reside in Raleigh, and I know that market really well, and it's just extraordinary how many schools and how many different arms that work with children have been helped. And I'm just astounded at that number, but I'm curious, for the next 5 years, what are the goals for you and your team when it comes to embracing what you've done so far since 2005 as a team? And with you being there for 3.5 years, what do you want to do next?
Exactly. Well, thanks so much for recognizing that. For us, and I don't think this would be disputed, but teachers are our everyday heroes. And what we all know is that the amount of trauma that educators and school staff have faced over the past 2 years really cannot be understated. And when we look to going into this next school year, and as we prepare over these summer months, it's really important for educators and for caregivers we like to say as airlines tell us to do, and that is to put their oxygen mask on first before helping others. And we have really made it a core to our work that when we're working with schools, that we're using our resources to help the schools create what we even refer to as decompression spaces for teachers, or setting up time for those me moments to help them fill their cups. This whole notion of self-care is critically important. It's not frivolous. It's critically important that the adults that are caring for our children for an enormous part of their day also have a chance to feel the support that they need to show up and be as healthy as possible. So it's important for us that caregivers take the time for themselves. And what we know is that is a real stepping point, a starting point to create a healthier generation together.
Kathy, you joined at a very auspicious time before the pandemic, and we talked to all our leaders and our CEOs about how it's affected us personally as well as professionally. With all of that said, what was it like March 2020? How did you pivot as a nonprofit, and where did it take you to today?
Well, that's a great question, because we all can, we can remember the time, the place, the weather, what we were wearing, all that information in March of that year. We were fortunate in our work to be able to pivot, and as I just mentioned, to really expand our work and making sure that we were reaching out to the caregivers or the teachers. certainly our focus is on equity and whole child health, and meaning that the youth do have the supports in place to thrive regardless of where they live, where they learn, where they play. But we recognize that health and well-being is interconnected, and the data shows that physical health as well as affects social emotional health and vice versa. So we know that we can't address one health outcome at a time. It used to be that way, right? We just thought about childhood obesity as one thing that we would focus on, but we know that health is interrelated. And so it helps us focus on the bold interventions that are interwoven and the challenges that we can address. And so with the pandemic, we were able to pivot our resources to help schools really navigate this ever-shifting environment while keeping students safe. And our assessments and resources and trainings ultimately served 3.2 million students and counting during that time period. So our ability to, we are a virtual organization. And so, and when we were created more than 15 years ago, technology was a significant part of who we are as a nonprofit. And that also started our equity journey, right from the very beginning, because anyone can access our information, online on our website. Through what we refer to as our action center. And so I think it underscores the historic commitment we've had to equity, but it certainly is, we are steadfast in our focus on that for the children in our country.
Well, I'm glad you brought that up, and I wanted to delve in a little bit more to this. I'm a 70s kid, so it was simple time. There's no internet. There's no phones. There's no nothing. Go outside, coming home for dinner that night. But I have a 20-year-old. I know you're a parent. You have twin boys. And as you talk to all these educators, it's more than educating the children and the parents and everything. We're living in such a complicated world with violence and politics, and kids are just trying to be kids, and we're trying to keep them healthy and get them the most education that they can and all the opportunities, especially in some of the urban areas and diverse communities that necessarily don't have it. And I imagine those are a lot of challenges that you discuss with your team on a daily basis.
Oh, exactly. And really you're bringing up a point too that just speaks to how we embrace diversity, how we encourage not only our own employees to be authentic and show up as their authentic selves, but then that's what gives us, I think, our own maybe personal mission fuel to do the work, so that, as you already said, our children are and the caregivers and the teachers and the staff that are supporting our children are faced with so many difficult challenges, that we need people to feel that we can recognize them, their whole self, and that they are in a position to do the work that they need to do to help our children have healthy environments.
Kathy, when I talk to CEOs and leaders of nonprofits, philanthropic partners are such a big deal. And it gets harder and harder at times to have donations and people believe in what you're doing. Tell me about your relationship along with your team on your philanthropic partners.
Well, we are so fortunate to have, and speaking about diversity, a diverse set of foundation, government, corporate supporters of our organization. We were really fortunate because of our work that we were doing to be recognized with a major grant from philanthropist Mackenzie Scott, who is really helping us now usher in a whole new era for Healthier Generation. We, as a result of her incredible support, we have hired a chief health equity officer, and this new role is really going to help ensure that we're accelerating as well as accountable for our health equity work, both internally and externally. We also plan to reestablish what is a hallmark initiative for us, and that is our National Leader Summit, which will celebrate school staff and establishing the schools as one of America's healthiest schools and supporting the students and families as they recover from the pandemic. And then I will say that, our focus to our future is how do we effectively double down on our programmatic delivery, including our market research and evaluation to ensure that really our program impacts at the community level serve the schools and the stakeholders as well. And the way that we most effectively do that is to be in relationship, in community, with connection. So we're building these new and improved systems together.
Beside Mackenzie's generous donation, what a wonderful thing that she's done for you and your nonprofit to grow over the next several years, you also have an amazing list of celebrity partners. And I've met enough celebrities. They're stretched with their time. And I think it's a testament to you and your team that you networked and told them about what you're doing and have them believe in it. How did you create all those relationships with all those celebrities?
Well, because they care too about, typically, they're either parents or they have, they're in community themselves and they want to support. I think these athletes, celebrities, they recognize the importance of a healthier generation. One of the things, that you're even speaking to that we most recently in honor of the 50th anniversary of Title IX, which really just this past week was the 50th anniversary. So we just finished our first ever virtual summit for a healthier future called Girls in Motion. And, we had more than or nearly 500 registrants for that. But what we were able to do, to your point, is bring together these leading minds in business and health and sports and recreation, education, from Olympic athletes to really women that are captains of their industry right now, and to talk about, to really have a forward-thinking discussion on gender equity and physical activity in sports. We know with girls that engagement in sport and engagement in physical activity drops off dramatically. And then when we think about their own health habits as they grow and mature, or we think about their other things like their self-confidence, their mental health and well-being, their ability to achieve things in let's say in the business or organizational realm, that these things are just really important. There are life skills that are learned on the field that then play out in the boardroom. And so if you're just a spectator, we know that you're less likely then to get into that boardroom, and we want to see more women there. So that's just a great example of celebrities, as you put it, and, gifted athletes and proven champions have embraced our work and really came together to put on like a phenomenal summit, which that information is, I just want to share, is available to anyone to view, even though the event took place last week. It's at healthiergeneration.org/Girls in Motion. So I hope people will check that out.
Well, it's an extraordinary list of celebrities, and as a father of a daughter, a 20-year-old, I think it's just wonderful that you go that extra mile for young women and for opportunities. So congratulations, and just wonderful to you and your team. As we put a bow on our conversation, Kathy, is there something that we haven't talked about yet that you want to make sure the listener knows about Healthier Generation?
Well, maybe a couple of things. One is I do think that we as an organization are recognized, and this is even why we were recognized by Mackenzie Scott. She evaluated 10,000 nonprofits and and did not invest in them, but in her early investments identified almost 500 that she did, and to be one of those. And that was because of our recognized work in health equity, and also recognizing this importance of diversity being embraced not only internally and how we support and want to grow in our journey as an organization and supporting our employees to show up as their authentic self, but then how that translates into our programmatic work and our external work in supporting, policy and practice change and environmental changes at the community level. So I think I would just underscore that piece right there.
Kathy, if somebody is interested in making a donation, being a partner, finding out more about what you and your team do there, or they just want to, check out and be a part of the organization, how do they go about doing that for the website?
Well, we invite and welcome them to come to healthiergeneration.org. Please navigate throughout our website areas that may interest you the most. And I think if you visit us, you'll be really delighted to know the work that we do or how you can be involved. So thank you for asking that.
Well, Kathy, thank you so much for your valuable time. Please give my best to your team. I'm so glad you got that healthy donation, but I know there's more work to be done out there. But because of people like you and your team, it's an opportunity for our young people to at least have a chance. So thank you so very much for joining us on CEOs You Should Know.
Thanks so much. I appreciate it.